Touche, and good evening, everyone. This is Jon Lascher from Partners in Health, Sierra Leone. Today is Tuesday, May 12th, and it also happens to be International Nurses Day. And May 5th, last week, was the International Day of the Midwife. And so in celebration of nurses across Partners in Health Sierra Leone's program, I wanted to speak with Vicky Reed, our Director of Nursing, and Isata Dumbuya, who runs our Maternal and Child Health program, and she happens to also be a nurse midwife. Before we speak with Vicky and Isata, I wanted to give a very brief COVID-19 update. There were no new recorded cases in the country today, but yesterday there were 31 new cases, and the total number of cases in the country is 338, and the total number of deaths is 20.
Hello.
Hi, Vicky.
Hello, how are you?
I'm good. How are you?
Does it sound much better?
It sounds a lot better, yeah.
I don't know what's going on with my phone.
So first of all, before we get started, I wanted to say Happy International Day of the Nurse.
Oh, thank you very much. Thank you very much. Thank you. Thank you. So this whole week, starting last Wednesday, started Nurses Week, International Nurses Week. So this year, 2020, was supposed to be the year of the nurse, International Year of the Nurse and Midwife. So it's the 200th anniversary of Florence Nightingale's birthday. So she would have been 200 years this year, 2020. So they decided to do like this huge celebration to recognize and celebrate nurses throughout the year. But usually every year you have Nurses Week celebrating from May 6th through May 12th every year. So that's the Nurses Week, and then which ends on Florence Nightingale's birthday on the 12th, which is International Nurses Day. So that's the whole celebration. Yeah, so basically she was the mother of nursing, I would say. So she was a nurse during the Crimean War, and she was known for basically infection control practices. Basically, her whole idea of nursing was more of looking at nursing as a holistic approach, not just taking care of the patient, the disease process, but also taking care of the patient's surroundings, taking care of the patient's, mental health, psychosocial health. So all of that incorporated. So it wasn't just a thing about taking care of the disease, but just looking at nursing as sort of like a holistic practice. So she basically started that.
And why did you decide to become a nurse?
It was, I would not say it was accidental. My grandmother was a nurse. She was a nurse and also midwife in Sierra Leone. She actually was a ward sister at Commerce Hospital years ago, and she also had her own clinic, sort of like a ANC clinic, and she also delivered patients there. So I sort of grew up, every weekend my parents would drop us off over my grandmother's house, and then we'll go to the clinic and, just run around the clinic, help her out, and just kind of saw everything that happened in the clinic on a daily basis. I never intended to go into nursing. In fact, I had a previous degree in international business with a minor in Spanish, and I volunteered at a hospital in D.C. 1 year, and I quit my job and went to nursing school. So my grandmother really inspired me. I think right after I became a nurse, I came to Sierra Leone for her funeral. And when we came, they had the funeral at the St. George's Cathedral, which is like one of the largest churches in Freetown. And I mean, just the crowds and crowds of people. There were people outside overflowing, and you had people come talking to you about how much my grandmother meant to them and the things that they remembered and how much impact she had on them. And I think for me, that it was kind of like a turning point for me, where I sort of looked at it like, I don't need to be in the U.S. to do, fantastic in nursing. This is somebody who never traveled outside of, never traveled to the U.S. or the U.K. or whatever, but she was able to make such an impact in the community that she served. And for me, that was one of the things that started spurring me to come back home. So nursing was sort of like accidental. I mean, accidental in the sense that I never intended to go into it, but I sort of grew up, with nurses around. One of our very good neighbors, she was also a nurse. And I was 10 years old. I had a burn injury, hot water burn injury. And she made such a huge impact, just the way she took care of me. So all of those people sort of inspired me, really. I've just never forgot those those moments.
Can you talk a little bit about what makes nurses so important to health systems?
Yeah, I mean, I think it's something where we hear people say it every single day that nurses, they are the ones that interact the most with the patients. And I think it's not just something that you just say cavalierly. I mean, it is really, really true. Nurses are the ones who interact with the patients the most um, on the front lines, any kind of disease process. I mean, I remember just um, working in different hospitals, and you'll see, for example, I work for the neuroscience unit, and you basically have patients you do not even leave the bedside for. You have to assess those patients every 15 minutes without fail. And at the end of the shift, after 12 or 14 hours, a neurosurgeon will come and say, hey, tell me about what happened with the patient. And you're able to give word for word, line by line, action by action, every single thing you did for that patient. And based on the information you provided for that patient, they're able to make decisions about what sort of care they can continue with that patient. So it is true that nurses are the ones who really, they impact care in that way that, based on the assessment of the patient, based on the recommendations, the clinician is able to, look at the patient as a whole and be able to decide what sort of treatment I'm going to give to that patient. And I think for me, that's kind of like where I want to see nursing here. Um, I want to, see nurses, other clinicians, other disciplines have the level of respect for nurses that, I used to see when I used to work as a nurse. You don't look at the nurse as someone, just on the sidelines. You basically involved with the patient's care. You help the doctors to make decisions. And I think that's what I want to advocate for nurses here. Not just as this side career where you just do that just because, you don't have anything else to do, but as a profession where people will have respect for what you do and that you are a contributing member of the healthcare team.
Can you talk a little bit about what role nurses play directly at Koidu Government Hospital and Wellbody and across Sierra Leone?
Yeah, I think one of the biggest roles that nurses play at the hospitals here, Wellbody and KGH, is basically you're sort of like the liaison, you're the advocate for the patients. You see a lot of times patients or families, the doctors will come in to talk to the patients, and they'll have pretty much no complaints, they have no concerns, and as soon as the doctor leaves, they ask the nurse, or, what did the doctor say? Explain to me. So what did they happen now? What is it for do, so the nurse basically has to spend that time to explain to the patient, make them understand the disease process, make them understand what the doctor just said, make them understand, what is going to happen in the next, few minutes or the next few days. So I think one of the biggest roles that nurses play in general here and around the world is you're the advocate for the patient, truly. I mean, a lot of times the patients and the families are so intimidated by those doctors because, they don't see them as often. They're more comfortable with the nurses because they spend so much time with them at the bedside. So I think that's one of the biggest roles that nurses play, being patient advocates.
Patient advocates, wow. And how big is the nursing team that you're a part of?
So at the hospital at KGH, there are about approximately 180 nurses, and these are all various cadres. So, of course, you have the midwives, who some of them are nurses. I think in Sierra Leone, for the most part, you have to be a nurse before you go on to study midwifery. So most of them are actually nurses. And then you have the SRNs, who are pretty much diploma nurses, and then you have the SCCHNs, who are certificate nurses. So there's various cadres, but in all, there are about 180, and of course at Wellbody, there are approximately 30 members of staff who are nurses, and those are also sort of varying cadres. You have the MCHAs, who are not actually trained nurses, but they also do the maternal health aides. So they basically assist the nurses with, patient care delivery of pregnant women.
And in terms of infectious diseases like Ebola and coronavirus, what role do nurses play in the delivery of care for infectious diseases?
I think it was a huge, huge role. I was not in Sierra Leone during Ebola, but I remember working in the U.S. during Ebola, and I give examples to people about how much preparedness, even though we knew that the likelihood of us receiving any patients with Ebola at our facility was very slim. I mean, how much preparedness we went through. Most of the training was done with nurses. And even here, now that we have coronavirus, this outbreak here, most of the training we're doing now is with nurses. I remember the first couple of cases we had that were suspected cases, how nervous the nurses were. And you had to, pretty much reassure them constantly that, we trying to make sure you're safe. We're not going to put you in harm's way. The very first suspected case, I remember the nurses were so nervous. I was not in scrubs. I came home and changed into scrubs so I could work with the nurses and say, hey, look, I'm here with you. Nobody's going to leave you here by yourself. And that progress that you've seen, I would say, a month in, this is approximately 1 month in, how much confidence they have now to actually take care of those patients. Now you sort of rest assured that you can be home and you have a suspected case and you can call in to check in and they say, oh, no, sister, we're fine. You don't need to come in. Everything is going on well. Of course, you still have to touch base on other things, but the level of confidence that they've just developed now, taking care of those patients, is just unimaginable to me.
What would you say to all the nurses in Sierra Leone and any other nurses that might be listening on International Nurses Day?
I think for us, including myself, this career path that I've chosen, this is a very, very, very difficult profession. It's emotionally draining, it's physically exhausting, but it's also very, very rewarding. But at the end of the day, all of this is just such fulfilling work. I mean, it's just so great to hear patients come back and tell you, hey, you took care of me, and they remember the small things you do for them. So I just want to encourage all nurses, no matter what it is that we're dealing with, no matter what it is, just, focus on that one patient who made that difference for you. Of course, you're not going to get that with every single patient, but there's always that one person who you always think about, that makes you keep on doing what you're doing. So for me, I always remember that one particular patient, so that no matter what happens, no matter what the difficult times, I always remember that one patient, that this is the person that makes me keep doing what it is I'm doing. So I wanted to encourage everybody to just think of that one person, because I'm sure every single one of us has had that one person.
Thanks, Vicky. Okay, we'll talk
soon.
I
appreciate it.
Bye.
Have a good one. Bye-bye.
Hello.
Hi, Isata. How are you?
Hi, how you doing?
Good. Happy International Nurses Day.
Oh, thank you. We've had a good day.
Thanks for everything you do.
Yeah, and thank you all for the support that you all gave in helping the nurses this time. We appreciate it.
Of course.
So today has been really, really good. The staff, we've had a great day celebrating. The staff all rallied round. We had lunch. We had breakfast together to start off with, and then had lunch. And they were all able to talk about how good it is to be a nurse, how much they enjoy their job, enjoy caring for patients, and sometimes even though they're not always appreciated, but as long as they go home feeling that they've done their best, they've invested in someone's life, they feel that I feel proud about what I've done today, and I'm happy with all the input that I've made and the difference that I've made in somebody's life. They all celebrated, and everyone stood up and gave a huge round of applause for themselves first, and then for the person next to you. And we couldn't do any sort of physical contact, but just a smile and an imaginary high five to say that, yes, this is it, this is for the nurses, and went out with the chorus of nurses and midwives, do it best. So a good day was had by all, and they were really happy that at least they were able to stand and be recognized for what they do. And then we ended up with promising each other that at the end of the year, at some point, coronavirus will go, and then we'll have a proper dance-off celebration to say that, nurses and midwives really rock, we rule. So that was our day.
Oh my God. Well, very well, very well deserved.
Yeah.
Thank you, Isata. Would you mind telling everyone why you decided to become a nurse?
Okay, for me, it was because I never trained to be in. My first choice of career was doing economics and law, so I never thought I'd be a nurse. I started doing nursing when my dad got ill, and kind of having to see him struggle through kidney failure and all of that. And once I'd been in a hospital and seen what people do and be allowed to sort of care for him in whichever way I could, I never left. I quit my first degree that I was doing. I was halfway through my third year, so I left that and went and started again and trained to become a nurse. I've never regretted it. I've never looked back or thought, oh, maybe I should have done something else. I could never, ever imagine myself doing anything else that's not nursing or midwifery related, because this is me, this is who I am, and just being able to be a part of others' lives and have that connection and see that difference and be able, even in the good times, in the sad times, whatever it is, just being there and saying that, how can I help you? What can I do for you? This is the only profession that I feel that you can do, and do that with a smile, mean it, and actually do something that impacts in this person's life, wherever they may be, wherever they may be. So for me, nursing, all the way.
What would you say to nurses across Sierra Leone today?
Today, to say that we love you all. We appreciate you. You're doing a fantastic job. People might not always say it, show it, or acknowledge it, but for all nurses all across Sierra Leone today, you're doing great. You're wonderful. Keep on going. Keep on smiling. Keep on doing it best. You're wonderful.
Thank you so much, Isata. You are wonderful, and all the nurses are wonderful, and thank you.
Thanks very much, Jon. Thank you.
Mm-hmm. Bye.
Bye.
Thank you to Vicky and Isata for taking some time to join us on the audio update today. And thank you to nurses across Sierra Leone and across the world for everything you do every single day. Hope everyone is having a great week, and we'll be back later this week with more audio updates from PIH Sierra Leone. Talk to you soon.